Being Patient Brain Talks. I'm Deborah Kahn, founder of Being Patient. Today, we're going to talk about a deficiency in energy to the brain and how that may relate to Alzheimer's disease. I'm so happy to have with us our friend Ed Blonz. Ed is from the UCSF School of, I'm getting your title all wrong, Ed, clinical pharmacy for the School of Pharmacy from UCSF, and he's a nutritional scientist. You may recognize him because we've had him on previously to talk about ketones. So we'll talk a little bit about that later on in the conversation and tell you how it all relates to the brain's energy. So Ed, thank you so much for joining us again.
A pleasure. I actually was the first video on Being Patient, so I'm honored to be back.
You absolutely were. I remember that. Okay, Ed, we've come a long way since then. So I want to talk. Let's go back to the basics for our audience, not knowing how much people know about the source of fuel for our brains. Typically, glucose is the source of fuel for our brains, but as we age, we have less of that glucose. Is that right to say?
Well, glucose is definitely the preferred fuel by the brain. And it doesn't get there the same way it gets to other organs. It's got to go through what's called the blood-brain barrier, which is kind of a border guard that keeps the bad substances from getting into the brain. So it's got to get through that blood-brain barrier. And what we find is as we age, less and less glucose is able to make that trip from the blood into the brain. So we end up getting a net decrease in the available fuel that the brain prefers.
Okay, and is it too simplistic to say with a less energy going to the brain, our brain becomes more susceptible to things like plaque in the brain or tangles?
Well, the way it works is that we've got a body which has plenty of glucose in what I call the lower 48, everything down below the brain. So the brain knows it's not starving, all right? The body knows it's not starving, but for some reason, the amount of energy in the brain gets lower and lower. So the body perceives as if there's something wrong, because one of the things that can go wrong in a body is that we get invaded by a microbe, a virus, a bacteria, a fungus. These things to survive have to be more efficient at getting resources than we are, because if we were more efficient, they couldn't survive in our body. So the body starts to react, oh my God, we got this microbe going on and it's in our brain and we've got to do something. We can't get the normal substances through the blood because it's got to get through the blood-brain barrier. So we have to produce our own homegrown, produced in the brain antimicrobial substance. That happens to be the precursor to amyloid plaque. Amyloid plaque is actually an antimicrobial substance used by the body. That's why it starts forming in the brain when there's not enough energy.
Okay, so is it as simple to say, let's just get more energy to our brains? And if so, how do we do that?
Right, that would be the best solution, obviously. Get more brain in there, get more energy into the brain. So how do you do that? One of the ways you do that actually is through vasodilation, through exercise. When you exercise, you end up producing more heat that has to get away from the muscles and relieved from the body, because the body requires certain temperatures for its biochemical reactions to take place. So you get this vasodilation to pick up the heat and travel around. But when you get vasodilation, you have a better ability for the glucose to work with the blood-brain barrier and get some through. And that's one of the reasons why people that are physically active tend to be at lower risk for Alzheimer's disease as well. Anything that relates to vascular health will be a benefit. But once you get past that, how do you get more fuel to the brain? It's become problematic because there aren't really that many fuels. The fats in our bloodstream really can't get through, especially if they're a large size fats and stuff. Protein, actually the brain starts to break down its own protein to use it for energy, which is one of the reasons we start to see the brains from Alzheimer's patients start to shrink. So much goes wrong without energy. And that's the question. How do we get that energy into the brain? I think by taking these fats that turn into ketones we might have an answer.
Okay, so this kind of dovetails into our last conversation, which we were talking about ketones being an alternative source of fuel for our brains. So
Yeah.
just to explain this to our viewers, what ketones are produced in the fat, right? And so when we, that like a ketogenic diet is reducing carbohydrates, so you're more burning your fuel from fat. Is that correct to say?
Yeah, so the way it works is that your body prefers glucose. It's set up to deal with glucose. Glucose is the only fuel that's called an anaerobic fuel. It can produce its energy without oxygen, but it's got a specific little portal through which it passes through the blood-brain barrier. It's got its own little glucose transporter protein 1. That's its job. Now, when that is not bringing enough glucose through, we cannot encourage it. There are some drugs that are trying to encourage it. There are some other things trying to encourage. Nothing's really working. But the ketones, when they get produced when there's not enough glucose in the body or when you take them orally. They go through a different pathway, the monocarboxylic transport pathway, and they don't have that same shutdown issue that the glucose transporter does. So they can get through when the glucose cannot.
Okay, so is it right to kind of say that perhaps alternating the source of fuel for our brains could be a good thing for our brains?
I would give them a variety. The main thing, though, is to find out whether you have the risk factors associated with Alzheimer's disease. And these are called the comorbidities. These include obesity, diabetes, cardiovascular disease, hypertension, and another one that's really coming up and we're learning more about are traumatic brain injuries. Because every time you have a concussion, whether it's from professional athletes or an explosion on the battlefield, your brain gets rattled and the ability of glucose to get through the blood-brain barrier is dampened. And that's one of the reasons we're finding professional boxers and soldiers and football players, when they get older in life, if they have these repeated incidents of traumatic brain injuries, they develop a condition called chronic traumatic encephalopathy, which puts them on the road to diabetes. And we're finding all these professional boxers now coming down with early diabetes, not because they weren't athletes, not because they were overweight and had these other problems, it's because they had the traumatic brain injuries.
Right. Okay, we're getting some questions in that I want to address. Someone has asked, so since fungal infection can infer or pass through the blood-brain barrier, then that could block the glucose from breaking through the brain. Does it work that way? Or do we know?
Well, the blood-brain barrier actually does protect you against funguses. If it didn't, we'd have a very cultured brain, that's for sure. But there was some thought, some thinking that it's fungal intrusion that's doing that, but that's not going to happen with a healthy blood brain. You want to get to the point before you have damages to your blood-brain barrier. So if later on, if you've already got Alzheimer's, if the glucose isn't coming through and the blood-brain barrier isn't properly maintained, remember, you've got to maintain it from the brain side. That means it has to have enough energy to do the cellular repair, not from the body side where it's got all that glucose. It needs the glucose in the brain. And if it doesn't even have enough to feed it to keep its energy going, it's not going to have enough to do the repairs it needs. So we do get a breakdown of brain tissue with the lack of energy. That could lead to a fungal intrusion, but I don't see that as a primary cause. Okay.
And another question here is from someone saying, my energy through the day is completely whipped out because of a brain injury. I'm constantly eating. I wonder if that's my brain telling me I need more energy.
It's difficult to say with that short of a statement. I certainly will have gone through with your physician to find out exactly what's going on, to find out if there's a correlation as to when you feel this way. It could be a perception. It could actually be a physical issue, but there's some testing that needs to be done. That type of abnormality should not be left slide. Find out what's going on.
Okay, and we should say that Ed's not a medical doctor, right? So we're not being prescriptive on any of this. We're just exploring what you've called neuroenergetic hypotheses, right? Is that
Yes.
the term that you've read? So let's talk a little bit about that, Ed. Is any of this being studied? Are there trials going on to better understand the link between an energy deficiency in the brain and and Alzheimer's disease?
Yeah, there is. In fact, Stephen Cunnane, his group up at the University of Sherbrooke in Canada, they have been doing some work with people with mild cognitive impairment. There was also the Axona Corporation that was doing this down in the United States, where they developed tricaprillin as a medical food that they were trying to give people. So what they're doing up in Canada now, and you could look for this, and I can provide a link to a wonderful video on YouTube that you can listen to. What they're finding is that they started giving people 15 grams a day of exogenous. In other words, this is not produced internally, it's taken externally. 1 tablespoon will give you 15 grams, 2 tablespoons will give you 30. They were giving people 15 and 30, didn't get much with 15, 30, they started getting some results. Now it's 30 and 45, and they are finding that people are showing improvements in cognition.
So exogenous ketones are basically like a supplement we can take, right?
Yeah, it's just a fat. It's just a liquid fat like any vegetable oil. It's an 8-carbon long fatty acid, but you've got to get, it makes up about 7% of the fats in coconut, 4% of the fats in palm kernel oil. But if you take coconut oil, you're getting 93% of the fats that aren't going to help you just to get that 7%. It's much better to just go and buy that C8 fatty acid if you're interested in trying this, because that goes right to the liver and it gets changed into a ketone body, which then can cross the blood-brain barrier. That's what they're doing up there. And it's really kind of fascinating. They've actually, everybody's looking for financial inducements here. Everybody's told me that I should patent this and so forth. I'm not interested in the money here. I'm interested in the science, getting the science out, get a way to actually find a pathway whereby people can get diagnosed at an early age, telling them they might be on the road to Alzheimer's, and this is how to never have those feet on that road.
So I want to talk a little bit about, last time we interviewed you, we were talking about traumatic brain injury and how to really study, if you had a traumatic brain injury, supplementing these exogenous, did I say that word right? Ketones would actually help in the healing process. But still, we need to do more research. Am I correct, or has research been
we
done?
definitely need more research. What we're dealing with it now is on the theoretical aspect, because not every traumatic brain injury, the priority is going to be getting more energy. It might actually be a penetrating wound or something like that. The real issue that we're dealing with here is that there is a potential that if you could provide for the energy of the traumatically injured brain, could you, remember I'm stating the question here, could you make it so that the lack of energy does not in any way contribute to the recovery or the lack of recovery from that trauma? So if we take that out as being a thing to be worried about, then the brain has all the energy it needs, it can do the repairs it needs, and you won't have that side effect.
So, I mean, again, we're not being prescriptive here. Everyone should talk to their doctors, but ketones are not, I mean, exogenous ketones are a supplement you could buy on Amazon, right? It's not, it's like taking a vitamin kind of, right? Is it not?
In a sense, it's more like a food, and it's exogenous. Estrogenous sounds like
sorry.
Exogenous, that's okay. Exogenous means it comes from outside the body. Exogen, so it's outside the body. Endogenous means from inside the body. So these are basically fatty acids that you find in food. And so the concept of calling them supplements, this is, I think it's in a transition right now. Once they become part of foods, once the articles start coming out in the nutrition journals about maybe even making this a conditionally essential nutrient, once we find the brain doesn't have the energy it requires, we're in this evolutionary stage right now that I'm hoping all this happens while I'm still around.
Okay, and another strange question. How could we possibly tell what the energy supply is going to our brains? I mean, how would anyone ever know if there was a deficiency, or should we just assume as we age, we're going to have a deficiency?
Well, I'm looking for there to be a biomarker test. I'm hoping that this is something that we're going to be able to handle. What this biomarker test will do is it will reflect when your brain has all the energy it requires to take care of business. All right, it's kind of a colloquial way of referring to it, but you understand what I'm saying. The precursor to amyloid plaque, if the brain has enough energy, it's operated on by one enzyme that turns it into soluble peptides, which then can leave the blood-brain barrier and go back and just contribute to the body's protein pool. When there's not enough energy in the brain, a different enzyme takes over. That enzyme changes it into the beta amyloid plaque. It's a series of enzymes, but the whole idea is we need to find out when is that good enzyme working and when does it no longer get the call and the bad enzyme is working. This is where we need to develop those biomarker tests. They will be sort of like a bellwether in terms of what's going on.
So could we detect things, these biomarkers in the blood? Could this be as simple as getting a blood test?
That's what I'm looking for. I'm looking to develop a blood test, and much in the same way we go to the doctor and go in for a colonoscopy, a preventive colonoscopy that we'll do every 10 years or so to make sure we can catch colon cancer before it becomes colon cancer. I'm looking for these to be part of your health profile that they go in. Research will tell you what age group will be. You'll develop your baseline, which will let you know whether your brain's kind of, and when it starts to drop below, this will be the time that you will then intervene. And the beauty about the test is that when you're getting a treatment and it's again establishing all the energy your brain requires, I am predicting that that blood test will then raise up to normal values again. And that'll be a bioindicator, and it can be used for so many things. I mean, we've got what's called the post-traumatic cognitive decline that we see in seniors after they awake from surgery, particularly brain surgery. They tend to be in this confused state. Well, we could find out whether the confused state is due to not enough energy getting to their brain. So we could find this out for so many things. I think it's going to be involved in other diseases as well. The main thing, we have to get that biomarker out, tested, and approved.
Okay, so this hypothesis seems quite straightforward to me. I mean, me being the non-scientist, it makes a lot of sense. It's logical. How far are we away from actually concluding that this could be, I mean, maybe take the disease part out of this, but this could be a good thing for our brains, and we should all be doing this as part of our brain health maintenance.
Yeah, if we could get that like an indicator to find out when you're anemic or something like that before you have any problems, that would be ideal. The real issue is that there's not that much money behind the research, because this is not like a pharmaceutical that's going to be made and patented. This is just a different way of eating and providing nutrients that your brain can use. And so until this gets onto the front stage of scientific consideration, where people are willing to roll up their sleeves and doing with it for its potential, rather than getting a grant from a pharmaceutical company, that would be fantastic. Just like we found out with AIDS that it wasn't one drug, it was a cocktail of drugs that really has been the answer. There might be a cocktail of drugs wherein an alternative source of energy could be the integral component that's missing. So we just approved a drug that will help break down plaque, but it doesn't stop or solve the problem for why that plaque was forming in the first place. So unless you can do that, all of these drugs which break down plaque in your brain, they might give you a short-term benefit, but they're not going to be a long-term solution because the plaque's just going to keep getting made.
So how how do we, like, from your perspective as a researcher, how do people like myself or other people watching help move the needle on this? I mean, if it's
Yeah.
not being funded, will we ever know? I mean, it's frustrating to me because I want to know the answers to these things. If it's
Yeah, it's extremely frustrating. I tell you, one of the reasons it's frustrating is that there's so much nonsense out there too. And the idea that this would get linked in with the nonsense is really disappointing, especially given how everybody knows people that have had Alzheimer's or Lewy body or any one of these cognitive issues. The key is going to be those people that are interested in it, that see it, that roll up the sleeves and start trying it. And I'm hoping that by spreading it and acting responsibly and staying scientific and not trying to make this a commercial gain, we will get enough voices. I'm also going around doing grand rounds talks at hospitals, very well accepted, because everything that I'm saying is evidence-based. And that's what you really want to look for. You want to look for evidence-based. You got a biochemical logic here that really explains a lot of what's going on.
So go through that process for us in the most simplistic way you possibly can. When we boost energy, or I mean, when we're babies, like, I've heard the brain changes a lot in terms of like how dependency and, energy sources, etc. So what is the evolution of that pattern of energy within our brains up until the point it starts to decline?
Well, everything works fine in the brain. Everything is going well. You're affected by your genes and your epigenetics, your behaviors in life and so forth. But then you have your lifestyle and your diet, which can give rise to being on the road towards these comorbidities, towards obesity, hypertension, diabetes, cardiovascular disease, and so forth. If you've got these going on and you're not taking care of yourself, you're hastening the period of time before which your brain is not going to be able to get the glucose it needs. There's also a genetic factor involved in here called the ApoE gene, and people that have 1 or 2 copies of the ApoE4 gene will have less of an ability for glucose to get through the blood-brain barrier, at least according to some animal models. They found that animal models with this start out life with a 29% reduced ability for glucose to get through the blood-brain barrier. So they're starting out at a disadvantage, and that's why people that have this, I know you said be brief, and I'm not, I'm sorry. That's why people with 2 of those genes end up getting Alzheimer's at an earlier age. So the thing we do is that we conduct our life and we eat in a way that we don't develop cardiovascular disease or diabetes or obesity or hypertension. And that's going to give us a leg up. Fascinating stuff here, right? They did this work on this tribe in Nigeria called the Yoruba. Now, in Nigeria, the Yoruba that have 2 copies of the ApoE4 gene, no relationship with Alzheimer's disease. But the Yoruba that have moved to the United States and are eating and acting the way other Americans do, these people with the exact same genes, very strong relationship between ApoE4 and Alzheimer's disease. So how we live our lives is probably the best determinant as to how risky our life is going to be.
What's the diet of the Aruba?
It tends to be more vegetarian and whole foods, but they're much more active and they don't have all the comorbidities in Nigeria. Here in the United States, they do.
Okay, well, thank you so much, Ed. I find this incredibly fascinating, an area that indeed needs a lot more research. Ed has a great PowerPoint presentation on neuroenergetics and his hypotheses. We will link to that in this talk. Ed, if you don't mind, we'll provide people with to have a look at more of your extensive hypotheses that you've outlined in a PowerPoint. If you have any questions, post them on this chat and we'll get them to Ed. But thank you, Ed. This is a fascinating topic. This is not going to be our last conversation. Indeed, there will be many more. So thank you for sharing your hypotheses with us. And yeah, I mean, tell people if they want to get in touch, can we just send the questions to you?
They certainly can, or they can send it through just to ed@blonz.com. That's my email address. And I'll do the best I can. I have a nationally syndicated newspaper column that's running all over the United States and internationally. So it's not always that easy to respond to everyone, but I'll do the best I can.
All right. Thank you so much, Ed, for your time, and to all of our audience. Thank you for watching. Please make sure you sign up for our newsletters, because we'll let you know about talks like these. And send us ideas or questions you may have. We at Being Patient can get the answers for you. Thanks everyone for watching. See you next time. Bye.
Stay well.